Hey, new video. So, as you could guess from the intro, we're going to be talking about obstetric. And I know nothing about obstetric. Thank you for the video. No, the last job I had to learn about obstetric because I was doing some obstetric transport. So the pictures you saw was from one of the day course that we had. I had training before that. I went to a few course called ALSO, which is Advanced Life Support for Obstetric, which is a 2-day course on how to deliver babies and everything. But obstetric has always been kind of a weakness of mine because I don't see them very often. But it's still important, I think, in self-reliance situation. It could be a situation that could happen. I mean, somebody could be mid-pregnancy and something happens, so you have to deliver a baby. Uh, if you remember in the past, I mentioned that course that I highly recommend is the EMT, so Emergency Medical Technician level. And part of the EMT course is that you get training in basic baby delivery. So this video is not so much about how to deliver babies, but a little bit of an update. A long time ago, I did a video called My Portable Clinic. And so I've been working on that project. And part of my project is that now I'm making a book that's going to be, let's see if I have it here. No. Anyway, it's going to be about this size, kind of a little binder. And I'm going to make some protocols. So, like schemes, like I mentioned before. So, basically, a little bit stuff like this where it helps you take decisions. And on this, I'm making lists as well of, and there's 30 of them that probably would see, so which covers about 85 to 90% of the things you may see. And what it helps me as well is that now I can build my clinic, my portable clinic, based on that, because each subject has this things, and basically I have to make sure that I have the right supplies to treat what I could perceive. And so that's why I find that approach helps me make my clinic a little bit better, because before it was a little bit too big of a project. And so it's getting worked on. But as you can see a little bit behind me, it's a little bit all over the place because I'm working on it as well as on the middle of moving. But it really helps because right now, so that's why I'm going to talk about obstetric. What I've been looking at is obstetric, and so the kit that I have, and do I have enough supplies for the to set up for an obstetric emergency. So this video, like I said, I'm not much of an expert. So, but what I will share is what I'll carry in my kit. And basically, my kit is based on what I've been reading and what I think would be a good fit for all that, as well as down below I'll have a lot of links of the books that I've been reading, PDF, and all that stuff is pretty much free that you can download. So midwife books and emergencies books on pregnancy emergencies, and a cool little cards that I'll show you on today. And all those links will be down. So yeah, so that will be about the obstetric. It is still it's like I said, it can still happen. Is it that important? Well, it depends on your things, but I think with very minimal money investment, you can pretty much, like I said, all those all those links that I'll put, everything is free, and then after that, pretty much. You can have all the stuff around. So basically, it's just having the knowledge. I don't think it's that much preparation. It's just getting ready. So if you know that somebody's gonna is like 2 months into, like, you have about a month or a month and a half to get prepared, that at least you can start reading those or still have them in your bag. So it doesn't mean that you need to know how to deliver. A lot of times there's not much complication, but they still happen, and so when there's a complication, you need to know what to do. So for very minimal, like I said, very minimal investment, I think you can have a pretty decent kit that could replenish all the emergency. Would that mean, well, all emergency, most of the emergency? Would that means that you can really preeclampsia and things like that? Probably not, because those are more medical condition. But again, based on what we were talking before and the philosophy of the self-reliance, at one point you may have to know, like, if you're in bugging out or moving out, maybe instead of continuing, then maybe that way you may start looking at more going towards um, other facilities, because this person will need that. So, like, instead of evacuating or going somewhere else, you may start wanting to go more towards a real facilities with professionals and stuff. So we'll talk. So again, you'll see all the links and stuff. I won't talk too much about them. Most of them are good reads. Some are a course for a midwife, and so that's why by focusing more on the midwife, because those are more home birth, it makes a little bit more sense to prepare for that. Because if you would read obstetric and gynecology, and it's a little bit more a hospital base, and then you're talking about surgeons and things, and so I think the midwife is the best way to go, and so that just because for what we're preparing. So the kit I mentioned before, I have it in the green. There's no reason for the green; just the red is for trauma, and the blue is, and the other one is green. So. One kit that you can buy, it's emergency disposable obstetric kit. You don't need to buy that, but it's just that everything's already inside the kit. So this is an old kit that I had in another first aid kit, but pretty much it has everything for a delivery. So right there, just by buying this, you're pretty good. But if you buy, if you download to the book of midwife, there's a page that explains to you all what you should pretty much have. And it comes like to 4x4s and towels and stuff. Things like this. You can always have like towels and things on the go instead of a kit like this. But it's just like I find that more convenient to have the kit and it fit well in that pocket. Next, well, the book, I'll have the book of midwife inside. So I bought the actually hard copy. You can download it as a PDF, but I like to have the hard copy, and it was not that expensive, and it's helping a good cause when you buy those books. They're like 15 or 20 bucks, but then they help developing countries, so I thought I would buy the book. So it's obviously a very good reference. It's very well done, and it gives you a lot of tricks on how to improvise some stuff, and also about diets, and if you don't have this, and there's actually a whole chapter on way to sterilize instrument if you're in the middle of nowhere, so like using bamboos and things like that. So it's very useful for things like that. So that's why this book, and also it fits in the kit. After that, some headlamp, because you want some light to see. Then I have a hand warmer if there's after the baby comes out, to keep it a little bit warmer if I need to, and things. Most babies, you'll have like blankets and things like that. I'm gonna buy another one, but for now I have this. So basically it's a Ziploc bag, and but what I'm gonna buy is those turkey bags. Is that if the baby comes out and you don't have like a warmer, this is actually some transport team. That's how they transport the babies. They just literally put the baby inside there. Obviously not with the head inside, but keeping the head outside and with something on the head to cover it. Basically now you can keep the baby much warmer. And this Ziploc could do in a pinch, but those turkey bags are even better. So that's what I'm going to put in that kit. After that, you have some sterile glove for some examination. And in some of the links that I'll put, I have like a little testing, because when you do to know the dilatations and stuff, and again, I'm not going into how a delivery is happening. There's probably good videos out there, and plus some of the reference, they talk all about it in really detail. But you need to assess the dilatation of the uterus and all that stuff. And so when you do vaginal exam, you need to know exactly how dilated you're all in the effacement that you have. In one of the pictures that you see, those red things, that's what it is. It's effacement and dilatation. So this little wheels, that's what it helps, because it tells you by centimeters. So basically when you do your test, you check with your fingers, and then let's say I come out that it's this, so then what I do is that you put it on the wheel, and it tells you, and there's a representation of paper of that wheels in one of those things. So basically you can do that. After that, some of the Book of Midwives, so if you have to do dehydrations, kits, and solutions, there's a little spoon that I use. So basically it's, I think this part is the salt. Yeah, sugar, sorry. This part is the sugar, and this part is salt, and then you mix that in a cup, and basically people can drink of this. So it's a nice little tool to mix quickly some solution for rehydrating people. After that, there's a Foley. Foley comes also with the condom. It can have multiple purpose, and I put a link on an article of why I can use it as well. It can be used for any, if you have an abdominal trauma, to stop a bleeding. So basically this kit stays inside there. Then I have for the neonate, and I have the triangle of how to resuscitate. So when they say PPV, it stands for positive pressure ventilation. So basically it's just bagging a baby. So this is a little bit big for the size, but you can still do until their chest kind of rise. So having a bag, and to do mouth to mouth if you don't have a bag, but I have one of the bags over here. It's my pediatric bag as well, but you can use it for neonate as well. It's just that you make sure that as long as their chest rise, that's enough air inside. One nice little card that I would recommend you guys have, or sorry, is the Also card, which is this card over here. This you can buy, and there's a link that I'm going to put. You can just send an email, say, hey, I want the card. They're $5 the card, but basically it's everything you need to know. That's that 2-day course that I did. Everything that you have over there of the fetal surveillance, what you should, like the emergency. So if you have during delivery, what kind of emergency can happen, what you should do, how you should do it, and very quick and happens over here. And obviously there's a little bit more stuff like a vacuum application, which you wouldn't have, but it concises very very quickly some good information. So always good to have, and for $5 it's very easy to carry over here. The next thing that I have is the hemoglobin color scales, was they use in developing countries. So if you want to know if a mother is anemic or something, that's the scales that you can buy. So yeah, basically you just point the finger, just like if you do a blood sugar for diabetic, and then after that there's a little color-coded page there, and then you, depending of the color, it tells you how much hemoglobin they have. So it's a very quick test to do. I use it for other stuff too, but it's for the kit and things. And lastly, one, and again it's going to be in the links, is if you want to practice your skills, is a little sheet that when you have like a cardboard box, basically now you can do a baby simulator. So how to generate a baby, and so that you can practice baby deliveries and things like that. So that's also in my reference. So anyway, that was the quick video, and I'll talk to you soon.